everybody. Welcome. We have a line out in the hall, so as soon as they get in here, we're going to go ahead and start with our welcome and everything. And just want to tell you we're so happy that you're here today. And we are, if you look at your setup in front of you, today is National Bittersweet Chocolate Day. Okay, National Bittersweet Chocolate Day. I know Valentine's is coming up, so if you're going to give chocolates, pick what kind? Bittersweet. Bittersweet or dark chocolate. Okay, works better. And it kind of gives you a little explanation there. It's kind of running off the page there. But can y'all tell that I love sweets? Isn't that terrible? I know that's just terrible, but I love it. So maybe I'm not the only one in the boat. We're going to start with our welcome, and Casey, come on down.
I'll be
We so appreciate Francis Tuttle opening their doors for us for this education. Of course, they believe in education, so we're going to let you welcome us.
Great. My name is Casey Craig, and I work here at Francis Tuttle. If you have not been on our campus, welcome to our campus. This is one of 4 campuses that we have, and this is our newest campus. So I was at our Rockwell campus, and we have a ton of construction going on over there because we are growing. If you look at the workforce, there's very much a need for, you're nodding your head, there's very much a need for tech centers and all of the things that we train for. So we're really excited that we're continuing to grow. We're really excited you're here on our campus today. If you are on any of our campuses in the month of February, it is the month of competition for us. All of our skills people, we actually, last week we had a ton of guys in here doing, it's called Skills USA. So a lot of the things that they do in training, they actually go to competitions. And we had a couple of people who actually made it all the way to nationals. So it's a pretty cool little thing that we do. Yeah, it's really exciting, but we're glad you guys are here because you guys are also very critical to what we do in our community and all the things. So welcome to Francis Tuttle. Awesome.
Thank you. Thank you so much. Well, we're going to turn it over to Mark. This is our educational partner, Mark with Nerve Renewal. And he's going to tell you a little bit about that and do his little spotlight for us.
Thanks, Connie. So at Nerve Renewal, we are in the business of treating pain and discomfort associated with peripheral neuropathy, which is a fancy term for nerve damage. And there's a lot of ways that we can get nerve damage, but what's unique about Nerve Renewal is that it's a drug-free approach that is covered by Medicare plus you. And Medicaid, VA, and most private insurance helps pay for this treatment. So what I'm going to show you today is just a short video. It's about 3 minutes long. This was a spotlight that was done by Channel 9 on Nerve Renewal last summer, and it does a good job of just kind of going over everything that we do, and it's much more entertaining than I am. So we'll watch that.
Do you have numbness, burning, or tingling in your hands or feet? Is it keeping you up at night? You may be experiencing neuropathy. We're here at Nerve Renewal, where we're learning more about the signs of neuropathy, the treatment, and how you can get relief. Greg, what brought you to Nerve Renewal?
Pain, nerve pain in my feet and legs.
Can you describe it?
Yes, it was just keeping me up at night and hard to get things done.
How would a person know that they are experiencing this?
Majority of the complaints that we hear is mostly the numbness, the tingling, the burning, the sharp shooting shocks in your body. So those are the elements that we usually kind of cater to.
I'd noticed when I was taking a shower and wash my hair, well, of course you close your eyes when you wash your hair. Well, I was having problems holding myself steady. I started hearing about nerve renewal and neuropathy, and I said, well, is that what that is? It's neuropathy. I didn't even know what it was called. I didn't even know it was a real thing. So I went over to the one on South May and started doing treatments over there. And I could tell 5 or 6 treatments in that was making a big change.
So when a person comes in, what can they expect in terms of the treatment?
They will be seen by a nurse practitioner who does a consultation on that patient, and if they qualify, we'll actually go into the treatment section, and they'll come in twice a week for 24 treatments, 30 minutes at a time.
So when you come in, describe kind of a treatment to someone who maybe has not done it before.
First of all, the staff is so friendly and welcoming. You sit in these wonderful recliners. It's just like being at home in your recliner if you have one.
Compare where you were before you started treatment and tell me where you are now.
I was skeptical because there's running probes in my leg and feet and stuff. But now it's gotten better.
Is this something that insurance will cover?
100% we are covered by insurance, whether that is Medicare, Medicaid, VA patients are able to come to us, essentially are able to accept most of the major insurance companies, and there are additional companies that we're always adding. So we recommend to people, if they're not sure if they're covered, to just call in, ask questions. This type of therapy just doesn't exist in most of the states. One of the other co-founders that had gone through surgery, and he had gone to a clinic that was like this, and he was like, we have to bring this to Oklahoma, because it was the only thing that actually got him through that last stage of recovery. So many people feel trapped by pain, by the inability to be able to get out and just go on a walk with their loved ones, whether it's a family member or their spouse, to being able to go through a few weeks, a few months of treatment, and all of those things have come back to them. And so the stories that they tell about where they were and where they are able to be now, it has a huge impact on everybody. You couldn't talk to a single member of Nerve Renewal that doesn't have an incredible story from a patient.
What would you tell someone who is considering trying this?
I would tell them that you are crazy if you don't do it. I would say it's just such a wonderful experience.
A lot of people don't really know what neuropathy is, and you get to find out once they get the treatment. So if you want to do something about it, get the treatment.
And a lot of it's covered by insurance, and so they do everything they can to help you with that too. So they really need to come check it out.
Can you guess which patient is a Elvis impersonator? Everybody has a brochure there in front of them that kind of goes over some more information. We have 13 locations around the state, 6 of them in the metro area. And if you guys have any other questions afterwards, feel free to come talk to me at the table. I do have another handout that if you really like to dig into the education and the science of what we're doing, I'd be happy to share one of those other handouts with you. So thank you very much.
Thank you, Mark. I think that is such a wonderful thing. I think Nerve Renewal it's helping so many people, and I think it's wonderful that it's no medication. I think that's really a very special need, and it's being met by Nerve Renewal. Well, I also want to remind you at the end, please visit our education partners tables, because there is, first of all, they have special information for you, but we retrieved a lot of new information regarding scams from last month's. So you want to make sure you get each of those pamphlets and those numbers to call, different things like that. And there's someone different at all the tables. So be sure that you go by and pick up the scam information, and you visit with our education partners and what they have to offer you as well toward this subject matter today. So I want you to give a big welcome to our speaker today. Dr. Wynn just does a phenomenal job, and she said, I don't need a PowerPoint, I don't need anything, I'm just going to talk with the people, and I love that about her, and she is just so kind. And as I went and introduced her to our education part, oh yes, I've heard of you, and different things like that. So I was really excited that she is here. She agreed to come and educate us today, and to just help us with this very, really important situation.
For having me. It's been a long time, I haven't done this seminar for a while. So, I hope you still remember me somewhere, right? Okay, so today, we're gonna learn about medication, about drug interaction, drug duplication, drug side effects. I just want you to listen, as always, when you listen to my seminar, I want you to have an open heart to learn new things, okay? But do not go home and stop your medicine, okay? So anything you want to make a decision on your medicine after this seminar, you have to discuss with your pharmacist and your physician, especially multiple physicians, not just one physician, okay? So, why are we here today? Because we want to learn about drug interaction, drug duplication, drug side effects, and of course, we want to minimize the fall risk, the injuries, hospitalization, and of course, increase quality of life and decrease the healthcare costs. Is that right? Is that what you want to be here for? Okay? So during my seminar, you can ask questions anytime, okay? If it pops in your mind, ask right away or write it down, okay? I want you to leave this seminar with things that you don't know and you want an answer. If I don't know, I will get back to you. I'll email you, I text you the answer, or you can text me your questions, okay?
So
Okay.
let's have them raise their hand and you call, and I'll go take the mic so
Okay.
they can hear the question.
Okay, are we agree on that? Okay, so first question. So this is 6 questions I put in this seminar. That's what Connie wanted us to learn about. So the first question is prescription drugs and over-the-counter. In this slide, on page number 2, the first slide, see that? You follow me? So I give you some example. Of course, there's so many examples with prescription and over-the-counter medicine. The popular one, when someone come into the pharmacy and ask me Sudafed, okay? I need a Sudafed, I have a congestion, I have allergies, I need a Sudafed. Or what your pharmacist will ask you, do you have high blood pressure? Do you have heart medicine? You're taking heart medicine? Those are the questions your pharmacist should ask you. Why? Because I answer in this slide. Because Sudafed can raise your blood pressure. During my school, my 4-year school, I'm working at a warfarin clinic. Warfarin is a blood thinner. So it's a clinic that monitors warfarin for patients. And I overheard a conversation with a pharmacist saying that a patient passed away because they take Sudafed and it interact with warfarin. And I always remember that. So I always ask that question, do you have heart condition? Because when you have heart condition, you have medicine that may interact with the other medicine. So, and then when you pick up a Sudafed, in the back, who read the box of medicine that you buy in the back? Who read the Sudafed box when you buy Sudafed? Nobody buys Sudafed? No?
Oh, yeah.
Do you read the back of the box? What it say?
I don't remember.
If you take MOA inhibitors, you should ask your pharmacist. So MOA inhibitors is a short term for alarm medical term, okay? So that is one of the medicine I listed here. It's a Parkinson medicine in that class. And when you take that, it might increase risk of hypertensive crisis. I wish it would say that in the box so they don't have, I have that question when patients really read what printed in the back of the Sudafed box. They say, what is that? They say, if you take Parkinson medicine, no, then you should be safe, okay? But if you take Parkinson medicine, you still can take Sudafed. They have to be 14 days. Then you have to quit one medicine for 14 days. So you have to quit taking Parkinson medicine for 14 days. And nobody gonna do that, right? So now you know, read what you buy, okay? Read the ingredients. So see if you're allergic to the inactive ingredients, read what the box said. Okay? Just like Imodium had black warning, and they printed outside the box too. A lot of over-the-counter medicine have those. Okay? Make sure you read. NSAID, lieutenant, warfarin. Okay, so now NSAID and steroid. Have you ever go to an urgent care and they give you a ibuprofen and prednisone together for your cold, your flu? Anyone? They all metro dose pack and ibuprofen because you have pain, you have inflammation. So those two drugs interact with each other. They both reduce inflammation, but they're opposite of each other. So when you take it, you might increase internal bleeding. So what I counsel the patient is you finish your steroid first, and then take your ibuprofen or metro dose pack. Okay? If you're in pain, you take Tylenol in the meanwhile. Because usually the prednisone schedule only for a few days. Metro dose pack for 6 days. Prednisone, usually doctor will prescribe for 3 days to 5 days. Okay? So when you take a steroid, do not take ibuprofen, naproxen, any NSAID until you finish that steroid. Does that make sense? Okay, did the doctor tell you about that? No. Okay. So now you know. Okay? If you accidentally take it, it's going to be okay. You're not going to die. Okay? But if you take it for long term, it might cause stomach problem. Okay? So if you're not sure, call your pharmacist. Or usually we counsel when patient picked up new prescription, we're going to remind the patient. Okay? So if you take meloxicam, long-term NSAID, or celecoxib, Celebrex, that's an NSAID. Okay? And if you go to the doctor and have a steroid because you're sick, make sure you ask. Or at least do not mix them together, at least 4 to 6 hours apart, and take with food. Okay, that will protect your stomach. Does it make sense? Okay, so go home and check on your medication list, is there an NSAID? And pay attention when you're sick. Did the doctor give you a steroid? Okay? Benadryl and painkillers, oxycodone, hydrocodone, anti-anxiety medicine, Xanax, Valium, those kind of medicine will increase the drowsiness. What is the drowsiness issue? Because it might increase fall risk. After you fell, what's next? You may end up in rehab and nursing home. Is that correct? So drowsiness is very important, and we'll discuss it later. Okay, next one, Tylenol, Percocet, and Norco. Did you know about Percocet and Norco? Have you taken Percocet or Norco before? Percocet is oxycodone and Tylenol combination. Norco is hydrocodone and Tylenol combination. So if you have a surgery, usually doctor will prescribe you a strong medicine like Percocet, Norco, morphine, or sometimes tramadol, codeine, which is less. So if you take Tylenol and then doctor prescribe Percocet, Norco, or you're taking Percocet and Norco as a long-term chronic pain, a lot of people have chronic pain and they on Percocet and Norco as long-term medicine, and then once in a while you have a headache, right? You didn't think, just pick up Tylenol and take it. So make sure when you take it, you have to calculate the amount of Tylenol, okay? The maximum dose for Tylenol for older adults is 3,000 milligrams. So each tablet of Tylenol, you're gonna read your bottle, read your box. Is that Tylenol 325, Tylenol 500, Tylenol 625? Have you ever read your over-the-counter the dosage before you take it? So watch that, okay? So if you take 325, that's about 8 to 9 tablets of Tylenol, right? And then you have Percocet and Norco, you take 4 times a day, so you have to subtract it out. Does that make sense? Okay, make sure you subtract it out, okay? Because if you overdose Tylenol, what's the problem? Anybody know? Liver damage, and you have to end up ER. That'll give you NAC. Okay, we'll talk about that supplement later. So that will reverse the Tylenol damage on the liver. So you will end up in the ER, or you have to call Poison Control Center if you feel like you overdosed the Tylenol. Okay? So first slide, are we clear? Any questions? Does that scare you? Okay, question.
It seems to me that people believe Tylenol is safe versus the other one that affects your kidneys. But most people, do they believe that long-term Tylenol is safe? Is that what you're finding?
Long-term Tylenol, if you take a low dose, it will be fine. The problem is, as you get older, your liver slows down, your kidneys slow down. Okay, you're not young when you take that Tylenol. So you have to consider, is my liver doing well? Is my kidneys well? All my organs are well? Because it will get backed up. Okay? It will stay in your body longer than when you're young, you get rid of stuff really fast. So one pill of Tylenol when you're young and one pill of Tylenol when you're old is different. So you have to make sure you check your lab. Okay? It will tell you when you have liver enzymes problem. That means you take statin meds or Tylenol meds. Some of the meds will call liver enzyme elevated. Okay? So check that. I cannot say it's safe or not, depends on each patient. Okay? Does that answer your question? Okay? Go to the next slide. Number 2, drowsiness and sedation can increase fall risk. This is very important for nursing homes, long-term care facilities. They really care about fall risk because that affects their numbers. Okay? So you don't want to end up in nursing home because taking medicine that causes the issue. So when you take, but sometimes you have no option. Then make sure the doctor has to prescribe the correct dose for you, for your age. Okay? So antidepressant, amitriptyline, benzos, Xanax, Ativan, Valium, antipsychotic. So if you take antipsychotics for sleep, which is not acceptable in nursing home, but a lot of nursing home patients take antipsychotic for sleep. Okay? So beware of the dose. Okay? And then diabetes medicine. All this medicine I listed is the top class of drugs that make elderly end up in the ER. You can Google it. Like top 5 drugs that make seniors end up in the ER, and try to avoid those drugs. Okay? So any drug that causes drowsiness, maybe one drug you're doing fine. A lot of patients when I call, they're doing fine with one drug. But you add more drugs with multiple drugs that cause side effects, the same side effects, you intensify that side effect. Does that make sense? So maybe one drug will give you a level 1. Maybe you have 2 drugs, 3 drugs, 4 drugs. In nursing home, we have patients on 20 drugs. Okay? So fall risk can happen. It may be not now, maybe later. Maybe at the moment you're not aware of. Okay, so blood pressure medicine, you're on multiple blood pressure medicine. Make sure you monitor your blood pressure. Because one day you wake up, you feel drowsy, right? And you might fall. Okay? So I list some drugs here not to scare you, but to tell you to be aware of it. If you take any of this medicine, make sure that you check with your physician. First question, is that safe? Is that effective? Is that good to start the medicine or de-prescribe the medicine? So those questions you should ask the doctor. Not just the question, is that safe? The question is that working for you? If it's not working for you, get rid of it. try something else that may be effective and safe for you. Okay, always remember that. Is that safe? Is that effective? Is that good to start the medicine? Is that good to stop the medicine at this time? Okay? Any question for the second slide? Yes.
My husband takes blood pressure medicine, and he cannot take Tylenol.
Which blood pressure medicine?
I don't know.
Why he cannot take Tylenol?
They tell him not to take Tylenol, to take ibuprofen.
That's usually the other way around. Because NSAID usually retain water and raise blood pressure, not Tylenol. Maybe the other way around, but I'm not sure. Maybe there's other reason behind why. You may have to ask.
Okay.
Yeah. Especially if you have heart condition, you shouldn't be on NSAID. Okay, because it's retained water. Steroid also retain water, so that's why you feel puffy when you're on a steroid. Right, it's retained water. NSAID will retain water, and it's not good for heart failure patients. Okay, but I have seen many heart patients on steroid on NSAID, so it's up to the doctor. Okay, it's not yes or no, black or white. It depends on the situation. Okay, number 3, question number 3, next page, okay? Mixed mental alcohol. Who don't drink alcohol in here? That's when I counsel patient. I said, do you drink alcohol? Everybody say no. Okay. Bonnie.
I didn't say no.
Okay. So, number 1 counseling point that I do every day is flagyl and do you know flagyl? Metronidazole. When you have a UTI, doctor will prescribe you flagyl and what else? Cipro. So when you take in flagyl, absolutely no alcohol. It's not just a little bit, just a sip, 0. Okay? Because you will have a feeling, even mouthwash has some alcohol. Some mouthwash have alcohol. Did you read the thing? That alcohol can trigger the side effects, the drug interaction between flagyl and alcohol. And you feel like you're allergic to the medicine. So all the symptoms I listed here, you feel like you're allergic to flagyl. Okay? I haven't heard any patient call back and complain about this drug interaction because we try to counsel patients that do not drink alcohol. We have to stop right at the beginning and do not touch alcohol when you're on this med. And at least after 48 hours after your therapy completed because the medicine needs time to get out of your body. Okay? So now you know. If you know your friends, and they're not here, tell them do not drink alcohol when they take flagyl, when they have UTI, okay? We talk about Tylenol, liver damage, and if you mix alcohol, it's even worse, right? Liver damage. Alcohol and NSAID, you have bleeding. So NSAID usually cause bleeding problem. Tylenol, liver problem. And then opioid and alcohol, a lot of death in Oklahoma related to opioid, because they're mixing opioid with Xanax, with anti-anxiety and muscle relaxant. We call it Trinity. Opioid, narcotics, right? Opioid, and then anti-anxiety benzos, and then muscle relaxant. Those 3 combo plus alcohol increasing your chance of fatal issue, okay? So when you take medicine, and I know some patients will call back and say, pharmacist, can I drink alcohol? I said, well, if you want, you can. It's not like you cannot drink alcohol, but do not mix them together. At least 4 hours. 4 hours or 6 hours apart. The reason for that, because you need time for alcohol or medicine to do their job first. Each of them do their job in your body, whatever you want them to do first, before you mix them together, okay? It's not a no-no, but you have to beware of that drug interaction. If something happens, you call Poison Control Center, or you call ER, you call pharmacist, you call your physician, okay? And then Ambien, Lumesta, Xanax, this is a sedation, sleeping medicine. I know a lot of people drink alcohol to sleep, right? And then they take sleeping medicines. You shouldn't do that. Maybe one time, and you still wake up the next day, but not every day, okay? Because one day it was, the reason for it, because it can slow your breathing, okay? And that's not good for you, okay? Any question on this slide? No? Okay.
Flagging all useful.
I'm sorry, say it again, I couldn't hear you.
What's this, Flagging? What's that used for?
No, what?
Very first word, say that.
Flagyl? Flagyl is an antibiotic for UTI. The generic name is metronidazole.
Tell them what a UTI is.
UTI is when you have infection down here. When you go to the bathroom, see burning sensation, or your urinary tract infection.
Inflammation down there.
Yeah,
Right.
infection,
Infection.
infection,
Okay.
and they can be inflamed, yeah.
Urinary tract infection.
Very good, okay.
You only see that when you have infection, urinary tract infection, or you call the doctor and say, hey, I have burning sensation when I go to the bathroom. They usually prescribe you Flagyl, Cipro, and if you're allergic to both, they can give you maybe doxycycline or cephalexin, so different kind of antibiotic. But this is like the number one choice. The combo with Cipro is number one choice. Yeah.
You said something about taking steroids, increasing water?
Water
Retention or
retention. Yeah.
For
So,
how long?
what-
month?
so until you stop the steroid, the water will go away. But if your body cannot get rid of the water, like if you have kidney issue, the water still retained, and you still puffy, you feel puffy, you feel swelling. So that's the steroid side effects.
Is that why, don't they most of the time tell you drink lots of fluids with all of these?
To get rid of, to clean the kidneys so it won't back up. So you know, a lot of cancer kids, they very puffy, right? So because they will tell you because I'm on steroid, or I'm on certain things that cause the issue. Okay, any question? Do we need a break? Or no?
We'll keep going, and then at the end, we'll have another QA. too.
Okay.
We'll just
Okay,
continue.
number 4, question number 4. I mean, this is a popular questions because, you know, the trend, right, using herbal medicine, natural medicine, right? So, people think it's a good thing, people think it's a bad thing. You have to stay in the middle, okay? So, good combination. So, when you I give you 2 examples. There's many examples of good combination of vitamins that supplement with your prescription medicine. Okay, if you're on the Lasix, doctor will prescribe potassium. That's the rule. They want, because when you're on Lasix, you get rid of a lot of potassium. Okay, so that's why they want you to have potassium go with Lasix furosemide. Okay. Sorry, during my presentation, I'll mix it with brand name generics. If you're not sure, then just raise your hand, okay? Methotrexate. If you take methotrexate, you will be on folic acid. That's the combo go together. Why? Because they help reduce the side effects. So what's the side effects of losing a lot of electrolytes? What's the side effects? Yeah, cramps. And a lot of things that you don't have, just like you have diarrhea, you lose a lot of electrolytes. So potassium will help reduce that side effects. Or folic acid, do the same thing. It helps the cell repair after the methotrexate destroys some of the cells in your body. So that's a combination, a good combination. You're gonna see more why certain prescription prescribed to you, or you have to ask the physician, why I'm taking folic acid, or what your folic acid will do to your body, okay? folic acid will help prevent anemia also, right? B12, folic acid, and iron. If you become anemic, you have to check which kind of anemia you have. Is that because of B12, because of folic acid, or because of iron? Do not start iron because doctors say you anemic, okay? Sometimes you're not low in iron, you're low in B12 and folic acid. So that's just different thing that you need to question yourself when you're on certain medicine or on certain supplement. Why you on that supplement? Do not take it because your friends tell you to, okay? Because you might not need it. Okay, bad combination. So when you go to doctor and you're sick, you got a Cipro again, UTI, doxycycline, and you have skin infection. Okay, doctor prescribe that to you. Then the pharmacist will counsel you that, hey, do not take the dairy product, calcium, iron, and magnesium. Okay, sometimes you take a multivitamin, they'll have all this in there. So make sure you don't mix them at least 2 hours apart. Okay, so the rule to take home if you don't know about the meth, if you don't know about drug interaction, you're not sure about it, nobody going to counsel you about it, just take a separate time. Does that make sense?
Yeah.
Okay, you don't have to call a pharmacist if you don't want to, but if you're not sure, just anytime you have a new drug, do not mix with your current medicine. Take it separately, see if you have side effects, if you have issue. Is that drug is safe or that drug is effective by itself, okay? And then St. John's wort is a herb over-the-counter that helps to treat depression. So this herb might decrease the effects of certain medicine, your heart medicine and your blood thinner, or if it take with antidepressant, it will cause what we call serotonin syndrome. So serotonin syndrome means you have a lot of serotonin in your brain. So when you have a lot of something, it's not good, right? So in short, if you want to start on herbal medicine, you can look it up. You don't have to call me. You don't have to call any pharmacist. You can Google, okay? You can go to a national website and learn about that herb and do what we don't have, a lot of times we don't have a lot of research about drug interaction with herbal medicine, but you can always look it up. When you look it up in the other research, or pharmacists will go look it up research for you in the natural medicine database, we can tell you certain detail about the herbs that you want to take, okay? I didn't say that it's safe or not safe. You want to make sure that you're educated about that product, okay? Any questions about this? Oh, there's two questions. Okay. Fine.
I've always heard potassium, people low in potassium, they eat bananas. Does it really help?
It depends. It depends. You have to check blood before you can tell. Okay? Maybe not a lot of banana. They say usually a half a banana is 10 milliequivalent. The whole banana is 20. Equal to that dose, a tablet, the giant tablet you say. But that's what they say. I never heard in school or anything like, hey, pharmacist, you can recommend banana. No, we didn't learn that in school. So I can't say that it's equivalent. But if you eat banana every day, it's good for you, right? If you don't have kidney issue. A lot of patients have kidney issue, the doctor will say avoid banana. Okay? So it all depends. Yeah.
My question was the good combination. What did you say furosemide was?
Furosemide is a Lasix that decrease if you have leg swelling, if you have heart failure, if you retain water in your body, usually the doctor will prescribe a diuretic. Furosemide is a popular choice. You can be on hydrochlorothiazide. You can be on other diuretic. But furosemide is a very popular choice in long-term care facilities and in the community. So I give you that example. Yes.
Okay, these have plus signs behind it. So are you saying take all three of those, which is a good combination, or either or?
Plus sign of what?
Plus signs. You have like furosemide plus potassium plus folic acid.
Oh, it's a comma.
Is that?
It's not a plus.
Oh,
A
okay.
comma, it's a potassium and furosemide combo.
Oh, okay, I thought you put all those together.
No,
Yes.
no. Methotrexate and folic acid is a combo.
All right, thank you.
Any more questions? Okay. One thing I didn't tell you, sometimes some of the supplement will reverse the use of the medicine. So like, let's say you take Tylenol and you take NAC. Okay, NAC can reverse out the effect of Tylenol. Okay, so sometimes on naloxone, have you heard about Narcan? Narcan spray? You see advertised on the highway, right? Narcan saves
Yes,
lives.
to help, the Narcan, if they're having a reaction.
Okay, so Narcan generic name is naloxone. Okay, so if you take opioids, run pain medicine, the Narcan will save your life. Why? Because Narcan can reverse of the damage oxycodone and hydrocodone might have on your body. Okay? So it can reverse the effect of the other. That's why drug interaction is very important, because sometimes you go to the doctor, you take this one for one thing, and you go to another doctor, take another medicine for another thing, and then you combine them together, and you come back and say it doesn't work. Right? Do you have that question sometimes? I try it for months, it never worked for me. You never think maybe a supplement that reverses out the effects, or maybe some other medicine that decrease the effectiveness of the medicine. So one thing we cancel on birth controls, like some antibody will reverse out, or we don't really say reverse, it's reduce the effectiveness of birth control. So we have to cancel on those things too. So just to let you know, everything's not perfect, right? But we need to be educated, be aware of the issue so that we could prevent it, right? Okay, so number 4 is done. We can move on. Yes.
You mentioned NAC. What's the appropriate way to take that? Because I take morning supplements and a couple of prescriptions, then in the evening I do the same thing. So when do you add in the NAC?
I usually like to cancel patient when you take supplement, just separate out from your medicine. Yeah, maybe in between lunch, you take medicine in the morning, medicine in the evening, then take all your supplement in the middle.
Okay.
So you don't interact with any other stuff. Does that make sense?
Yes, so in other words, standing at your kitchen sink in the morning, first thing when you get up, you're making your coffee, you take all your vitamins, all your supplements, all your meds. Not good.
No.
There you go.
I have been to a home that they put everything in a bowl.
Yeah.
So it's horrible when you see a bowl of medicine you have to take every day. So if you separate out, okay? Separate out, that may be safer for you. Maybe in long-term care facility, they don't have that choice, okay? Because they have limited nursing staff. So they have to give you everything. If you have one daily prescription, everything will be in the morning. If you have bedtime, everything at bedtime. So they don't have a choice like you do in the community. You have a choice to prevent all of this happening, right? Then you separate it out. That probably safer, and it give you a chance to make things work, especially if everybody take thyroid medicine or Foxamax medicine first thing in the morning on an empty stomach, just water, no other medicine, no caffeine, no food. Did you see that direction from your pharmacist? So Foxamax thyroid have to be by itself. Why? Because the supplements, the vitamins can reduce the effectiveness of your thyroid. And if you do take them together, like I say, some people say they don't want to take thyroid by itself. They will to combine everything. Then the doctor have to adjust the dose. You might be on a higher dose because of the effectiveness of the thyroid. Yes.
If they don't give you a choice to take it morning or night, can you take it when you want a thyroid medicine?
Thyroid usually come first thing morning, but sometimes you don't remember to take first thing morning. Then take at the period when you're on your empty stomach. You can take any time on an empty stomach before other food. Yeah, but you have to be consistent, okay? Do not take like one day in the morning, one day at night. If you take all at night, because I know some nursing facility, they change thyroid dose to at night bedtime because they don't want to wake up resident in the morning at 6 a.m. in the morning to take thyroid medicine. Have you heard about that? Yeah. So you know, if you don't want to wake up 6 morning, that's fine. But you have to be consistent with thyroid. Same thing with warfarin. You have to be consistent. If you eat a lot of vegetables, that reduce the effectiveness of warfarin. Vitamin K. So if you're on warfarin, watch out for vitamin K. Vitamin K in green vegetables. So if you love green vegetables, you can still eat it. You can still take warfarin, but be consistent so that the warfarin clinic will adjust the dose for you, for your lifestyle. Same thing with thyroid. Does that make sense? So it's doable. Drug interaction is doable. We have to go around and make it adjustment. Make sure you tell doctor, make sure you tell pharmacist, make adjustment that works for your lifestyle. Okay? Does that make sense? Okay, is it better?
Well, yeah, but
Yes?
I'm not gonna wake up early and take it, so I guess.
You don't have to wake up early. Okay, you can take home that message. You don't have to wake up early. Yes?
Yeah, I found, and maybe that's just because I'm lazy, but I took my phone and took a picture of all my vitamins and herbs that I take bottles. Took a picture of the bottles. And then I went to my pharmacist and showed them that picture. And I said, all right, given the medication that I'm on, which is only one item, but what you recommend or what you advise me as far as taking, when I take these, and are they the proper amounts, et cetera. And that was the easiest. Like I said, I might be lazy, so I didn't look it up. I had a pharmacist tell me, and I got real good advice, a lot of what you're saying. Just from the pharmacist, by showing the picture of all the bottles, you know, of vitamins or herbs that I take, and that was real helpful.
Thank you.
And did they give you good advice? I mean, did they express about each thing, when you should take it, what time of day, and things like that?
No, I didn't ask that specifically, but the medication I take at nighttime. Anyway, so.
That's good.
Yeah.
If your pharmacist answered your questions, that's good. Yes.
Can you take too many, can you take too many of the over-the-counter or herbal supplements?
Yes. Like I say, when you take something, you have to ask yourself, is that really needed? Okay? Okay, is that really needed? Or if you want to try, say, is that really effective? Is that, do not follow the trend, okay? I know whatever TikTok or YouTube, Facebook say something, we sell that product crazy the next day. We even locked up Imodium on some of the pharmacy because people steal Imodium. Do you know Imodium for diarrhea? People abuse that. That's how much TikTok, social media affect, but it's helped our pharmacy's business. That's why I have a job, so I can't say that. But yeah, so yes, if you take too much medicine, your body will work overtime for it.
So should your physician know what you're taking?
They don't have to. They should.
Yeah.
That's why I come up with the next 2 slides.
Okay. So I should inform my physician that I'm taking this, and this.
Only if that physician got educated about medicine. If they only got educated about their disease and the drug, what they treat you for, they have no idea about other medicine, they can't answer your questions.
So only pharmacists can do that.
Pharmacists can help to catch that. We like police. We track opioid overdose. We track a lot of stuff because anything federal is on pharmacists. I think in Oklahoma, pharmacists were 50% responsible for your medicine. Physician 50%.
But when you're taking a prescription, when a physician prescribes a prescription medication, and you're on something that interacts with it or doesn't interact well, whatever, it flags it. So
Yeah.
it won't allow them to prescribe that. But it's
No.
not the same with a supplement.
So only some supplement, not all supplement. Yeah, so we pharmacists cannot catch the drug interaction because we don't have data to put in the system for all their supplements. There's so many. We catch a few. We catch vitamins. If we prescribe, if we dispense our vitamins to you, we catch a few. We'll call you and say, hey, are you still on that one? Hey, hold off on that medicine. Hold off your calcium while you're on that antibiotic. Or make sure you separate out. We catch some of this, but not everything. It's impossible. That's why you have to be educated yourself to learn that, hey, it might be. If your gut feeling says something, say, I don't feel right about this combination. Call somebody on Google, Dr. Google. I know people don't believe in Google, but I Google too, okay? So, of course, when you Google, you look for the website. They say, this is from the National Research Center, or this is from PubMed. That's how pharmacist, doctor, and physician healthcare provider look up is PubMed. We're looking into official websites. So you do the same thing. You look, you Google it will have a bunch of websites. You pick the website that official. Okay? Do not pick random website. You might get spam. But pick the good website or the National Complementary Health and Integrated Medicine. You can pick those to learn about all the herbals, all the stuff that we don't have the data. Okay? So anything come out new, look it up. Okay, if you learn a supplement, your friend's selling you a supplement, look it up. What on the label and what it say on the National Research Center, what it say about it. If they say they don't have a lot of data, then you risk yourself 50% of your chance, right? If it works or not working. Okay, yes. Bonnie, an expert in this.
Oh, yeah, I don't take any meds. I just want to know, because I got a lot of friends that take omeprazole, and I don't know how to say it. But I would like you to just mention a little bit. Number one, is it true that you don't stay on it long term? And two, what are some side effects?
Okay, so that will be on my last page, okay? We'll talk about omeprazole. That's my last sentence on my slide. Okay, let's do number 5, okay? So I saved that, Bonnie, okay? Remind me.
Sure.
Okay, number 5. This is the problem with a lot of elderly when we go to multiple specialists, right? And this is, I list out some of this example that I catch when I fill prescription, okay? So I see patient on metoprolol and propranolol. You go to one doctor, your heart doctor will prescribe metoprolol for your blood pressure for your heart, to control your heart rate. You go to your primary care, they will prescribe propranolol for your anxiety. You know propranolol now is very popular next to Xanax for anxiety, especially students, because when they do have testing anxiety, they have, speaking, like stand up here, they notice they have to take propranolol, okay? My daughter takes propranolol for test and she loves it. It helps to calm her down. So it helps to calm your heart rate. So it's good, and it's for anxiety. Now, so whenever I counsel a patient on propranolol, I have to ask them, are you taking it for blood pressure or for anxiety? Most young people will say anxiety, and I have to counsel them next. This is a blood pressure medicine. Make sure you monitor your blood pressure and your heart rate, because you will have side effects just like blood pressure. Does that make sense? So, when I'm a consultant pharmacist for long-term care facility, this is what I found. So some patient on both, right? Because when they admitted to nursing home, they just, nursing home would just get your medication list, get into the computer, and then give you the medicine. So that's when I have to make recommendation to discontinue one. So either you're on propranolol for both indication, or you're on metoprolol. You cannot be both on beta blockers because it's gonna slow down your heart and breathing, and it's not good, right? And it lowers your blood pressure, so it's not good. So when you see duplication like that, you see how important to fill prescription at one place. So pharmacists can help catch that. If you fill it mail order, you fill it Walgreens, CVS, Walmart, you fill everywhere, nobody gonna catch that for you. We don't have supercomputer to catch that for you. So that's one of the popular drug interaction that you have to pay attention. And you on multiple beta blockers. I see soberol and metoprolol. I see many duplication of beta blockers. And I hate to call the doctor. Doctor usually would yell at me like, who are you to tell me what to do? That's what I get from the doctor. So I want you to be your own advocate for your own medicine, okay? Because I got yelled a lot when I call. Or even I make recommendation in nursing home. They denied it. So, 2, Celebrex. I think we talked about this earlier. Celebrex is an NSAID. So you're on NSAID for long-term chronic pain, and you went to ER and you have something pain pop up. I see a lot of ketorolac prescribed from the ER. I don't know why recently. I feel a lot of ketorolac. Ketorolac is an NSAID. It will pop red on my computer. Cancel patient. The patient already on Celebrex. Patient already on naproxen. Patient already on ibuprofen. See, I tell you, ER doctor won't catch that, right? So I have to call and say, hey, are you doing, which NSAID do you want? You want ketorolac or do you want Celebrex? So I have to ask the patient that. I give them a choice. If you take ketorolac, you have to hold on to other NSAID. You cannot be both because of internal bleeding, right? We learned about that. Okay, diltiazem and amlodipine. I see this one case. I tried several months to ask the doctor to discontinue one of them because they're in the same class of drug, even though they have different names, right? But they're in the same class. You cannot prescribe. That's the rule in pharmacy school. You should not prescribe the same drug in the same class for the patient. But if you go to multiple doctors, they didn't catch that, then you have the issue. Okay? Okay, next one, terazosin, prazosin. I see a lot of prazosin prescribed for nightmares or PTSD. Have you heard about this one? Anyone? No? This one very popular to treat nightmare. This is a blood pressure medicine. And then a doctor, you go to a mental health doctor that prescribes terazosin for nightmare. You go to your regular doctor that prescribes terazosin for blood pressure. And now they're the same thing, right? So you see how dangerous this is to go to multiple doctors that not learn much about the duplication. Then that's become a dangerous thing, okay? I have seen Cymbalta. Cymbalta is an antidepressant, but it helps with nerve pain, just like gabapentin. It do that job. So some doctor will prescribe Cymbalta for pain, and some doctor will prescribe, I'll give you an example, Prozac Effexor for depression. That's the duplication. Especially if they've been on Effexor and Cymbalta. Cymbalta and Effexor are on the same class. Prozac and Zoloft on the same class. But they do the same thing. They help with your depression. Okay? And I have the last one, I see multiple patients on multiple blood thinners. Especially in nursing home, I have seen multiple blood thinner for patients, like 2-3 medicine for blood thinner. And you can tell when you read the lab that that it's not a good choice to be on free blood thinner. If one, well, the reason for doctor put you on it because they're not sure if the drug is working for you, so they put you on a bunch of them. But then they say, well, because this is what they, that is the protocol. But the protocol usually good for short term, not long term, not forever, right? Like after you have surgery, they put you on multiple blood thinner, just make sure it flow in your body, right? But after that, I think they forget to take you off. And then when you're admitted to rehab, admitted to nursing home, you keep going to blood thinners. So nobody stop it. I have patients on digoxin forever. They just renew refills until I cancel her. I say, why are you on digoxin? She says she doesn't know. Why is she on digoxin? It's because her doctor is afraid to get her off. But I asked her, do you have that issue anymore? She said, no, just one time only. Same thing with antidepressant. Some senior on antidepressant forever or antipsychotic forever just because of one episode in their life. Something happened in their life, they need to be on that medicine, and they just need that prescription forever. And you go to multiple doctors telling the same story, right? What happened when you say the same story to multiple doctors? They prescribe you the same thing.
They want to fix it.
Yeah, they fix it. They will prescribe you the same thing. They look at your med list and they say, oh, you're not on it, I'll put you on it. You're not on this one, I put you on this one, right? Multiple doctors have multiple protocol to put you on medicine and then turn around. You're on same class of drugs for the same thing, duplication. Okay? So that's the reason why you have to be extra careful when you go to different specialists. Okay? You should pick the one that has pharmacists on the team. That probably safer. I don't know who got the pharmacists on the team. I know some hospitals have pharmacists on the team now, so hopefully they help you catch all of that. Okay? What time is it?
You're doing great. I'm just going to take a quick break before we go to the last panel and move on to questions. Just want to remind you guys some housekeeping. Please remember to complete your eval forms and give those to us. We appreciate that. And I want you to be sure and visit the Education Partners tables because we have viable, wonderful scam information that we've printed off for you as an extension from January's seminar. And each table has a little different pamphlet, handout. So you want to be sure and visit all of our education partners to pick that up and to pick up what they have for you also. And if you have any questions for them, they're here to help you any way they can. And so they're the experts in their field, so be sure and visit our education partners to get that additional information. It's always helpful to the more we learn, the more we know, right? So be sure to do that. No one brought a friend this week, so I guess I'll have to take my little chicken $50 chicken card and keep it for next month, okay? We will be in Mustang next month, so put on your tracking shoes and head to Mustang to be a part of that. Living to be 100, and we're going to move on to Q&A and let her finish her seminar.
Oh, we're not taking a break? No?
Everybody stand up. Everybody stand up. Take your arms, and as you're lifting them, say, what all do I take? And then let it go. What can I let go of? All right? Yes. Is your contact information on this?
No.
They've got some lady.
Okay.
We'll email it to you.
Yeah, she had my
We'll email it to you.
Yeah.
You have a question about the last thing about.
Okay, now you may sit down. What's your question? Real quick.
Go ahead and ask the question.
On the stomach medication,
Okay.
are you saying basically not
not to use for long term.
So if you only use them occasionally when you had a situation as opposed to just using them continually, you're saying that's fine?
No, that's why I couldn't hear that. Say it again.
If you were just using the medication only occasionally, not continually,
Right,
is that?
that's fine.
Okay.
As long as you don't have the symptoms, that's fine. So, back to Bonnie's questions on omeprazole, pantoprazole. I see duplication on both. I see so when I see prescription pop up on my screen, patient rate and pantoprazole, doctor prescribed omeprazole, I always call and say, did the doctor tell you to stop? Or the doctor didn't tell me? See? So if the doctor did not tell the patient to stop one and start the other, now you have duplication. So I tell them, okay, you want to call them or do you want me to call them? Then you need to stop one or the other, not both. You're not supposed to be on pantoprazole and omeprazole, okay? So if you see something that spells similar, just ask. Because sometimes it usually indicates they're in the same class of meds, okay? Why it's not, so on the beer list, you can Google after this, the beer list from the the American Geriatric Society. It have a whole long list of medicine that should not be prescribed in older adults. But they didn't say that absolutely no. You still need some of the medicine for treatment, right? But for long term, you have to, on that beer list, it's like omeprazole, what we call PPI, proton pump inhibitor. Usually they recommend only for 14 days. And you see that when you pick up a Pharmacist over the counter, or Nexium over the counter, on the bottle it say only recommend for short term, 14 days. Same thing. That's the one they recommend for older adults on the beer list. Okay? So short term, fine. Maybe occasionally, fine. The reason is omeprazole proton pump inhibitor will prevent the absorption of your vitamins. So vitamins, or folic acid, iron, calcium, all that, because it's protect your stomach. But at the same time, if some medicine that protect your stomach, that means some of the important vitamins will not be absorbed appropriately. So long term, you may become anemic. You cause other issue. What happens when you become long-term anemic? You may start having Alzheimer or dementia. So that's why it's not recommended for long term. Okay? So when you are long-term PPI, you have to check your vitamin level. Make sure that if you lack of something, take that supplement if you want to be long-term omeprazole. So it's not good to be on long-term. There's a reason for it. Why it's on the deal list? Because there's a reason for it. Okay? So the deal list got put together by all the experts in geriatrics, all the geriatric pharmacists, geriatric physicians. They put together a deal list for a reason. Why they recommend certain dose, why they recommend certain things. Like if you're on gabapentin, for seniors, you have to check your kidney. You should not be on high dose of gabapentin for nerve pain when you have kidney issue. Or Lyrica, same thing. Or maybe Bactrim. If you have kidney issue, you should not be on a high dose of Bactrim, the double dose. You should be on just the regular dose. Or if you're on COVID medicine, you know, COVID medicine have two packages, one for regular dose, one for seniors with renal issue. So when you have kidney issue, always ask the physician, is that the right dose for me when I have kidney issue? Because we have dose adjusted for kidney patient. So those usually on the bill list will tell you which medicine that we should be on for short term, long term, or should not be at all. So they have different criteria on that bill list. And I just listed here. If you look at this, all this medicine on question number 6, it looks very similar to the question sedation. The sedation one, the side effects, that's the reason why it's on the list. Anything that's not safe for seniors, it will be on the list. Okay? But it doesn't mean that you cannot use it. You may have to adjust the dose that is safe and effective for you, okay? So all that medicine listed, you can use them. But make sure you use the lowest dose that help you to achieve whatever you need to achieve, okay? So if you're not sure, again, Google it. I tell you to Google it, but do not trust Google 100%. Make sure you get to the correct website, okay? So like the B list, make sure you get onto American Geriatric Society. That's the geriatric physician and pharmacist come up with this. It's originally come up from Dr. Beers. That's his name, Dr. Beers. And he come up with this list. And over time, there's more physicians and pharmacists approve that list. So we got drug get on the list and get off the list, depending on their research, depending on what they find out when they prescribe the medicine.
What's the medical?
The Beers list.
No, the whole name.
American Geriatric Society. Okay? So if you want to learn about that list, you can get on there and learn. But again, it's not an absolutely yes or no. It depends on your kidney, depends on your liver, depends on the situation, the side effects that you have. Okay? Yes.
And beer, initials for something, B-E-E-R, does that mean something? Like
the beer is the last name of a physician that come up with that list.
Okay.
Yeah.
In his honor, right?
Right.
In his honor, Dr. Beer.
But you can find it on the American Geriatric Society.
Yes,
Okay.
if you want to learn about it. But most of the time, it's just mainly the drug that cause drowsiness, the drug cause kidney issue or liver issue. That's mainly those on the list. But which doctor do follow that, I'm not sure. But we usually, in the community now, we usually have a flag up and say, oh, this drug not appropriate in geriatric. We have that flag in our pharmacy computer now that say, oh, this drug. I usually have to override it because I'm gonna get yelled when I call the physician, like, oh, you should not prescribe this, you should not prescribe that. Doctor didn't want to hear that. Okay, any other questions? We have all the questions answered?
Okay, if you have them right up front.
In treating peripheral neuropathy, we see a lot of patients that are on Cymbalta or gabapentin. Is there anything on the horizon, medication-wise, that maybe has less side effects than some of those medications?
So drug company are very smart. They come with like gabapentin. They come up with the extended release of gabapentin, which is very expensive. They come up with long-term extended release, or they come up with new names to treat the same issue. But a lot of time, patient cannot afford them. So we don't dispense a lot of expensive medicine in the pharmacy. It's hard to tell you like which one. Whatever on the TV, usually we'll get it filled in the pharmacy. But if they're not expensive, yes, it will be a fast mover. If it's very expensive, it's just for short term and then we don't dispense that anymore.
But are they, I think part of his question is, are they always working to find medicines that have less side effects to people? Because you watch on television and they'll say, you can take this medicine, and then they just really rush through it. It can cause death, it can cause this, it can cause all that. And you're like, if you listen to that, you get really, oh my word, I'm on this? So are they always trying to help people that way?
The doctor or the pharmacist?
No, the creator of the drugs. Yeah, pharmaceutical.
I think the creator of the drug is to find the issue, then have something to treat that issue. They don't care about other stuff. If they care about other stuff, they're not going to come up with the drugs because there's so many drug interaction and side effects that listed with it, right? So they just want to find a solution. Like if this is the problem, this is a solution, period. And the rest, I don't care. That's how I feel when I dispense the medicine. I said, well, this one has jumping by side effects, but, well, doctor know everything. That's the question I have, so. Yeah, it's very, so if the patient really cares, they'll ask pharmacists for more. If they don't care, they will say, well, my doctor know about it. Who say that when they talk to pharmacists? No?
So what is the best form, and then I want, come on down, because I really would love for Casey to share her story with her husband, because it's so phenomenal. But I just have a big question on that, I think that's in all of our minds. These drugs and how it affects constipation, right? If it causes constipation, what's the best form?
Okay, so a lot of drugs listed on the D list are anticholinergic. Anticholinergic, if you combine multiple medicines that's called drowsiness, those mainly, a lot of them are anticholinergic, which means can cause constipation, okay? So some doctor would say, hey, go take a Colace, a Miralax, right? Or any other medicine over the counter to treat your constipation. Well, what if patient asks me that question? I say, go eat papaya, go eat kiwis, go eat papaya, kiwi, pineapple. Why? Because those fruit have enzymes that help to break down the meat inside your gut, and it help, and lots of fiber too. It help help the bowel movement. So that,
in a God-given thing, right? Natural
way. So that's how I treat my constipation. I don't take Colace. I don't take Miralax. So that's how I tell them to treat their constipation. So doctor will say, hey, take Colace, take Miralax every day. That's what nursing home patients do. They take Colace, they take laxative, they take Miralax. Some patients in nursing home get on 3, 4, 5 prescription for constipation. A lot. But I cannot tell nursing home patient, go eat your papaya, go eat your kiwi. I cannot say that. But I can tell it to you. You can go and shop around for your fruit and pick the fruit that's more helpful to you, right? So that's different depending on who you talk to.
What was that third fruit again?
Kiwi, papaya, and pineapple.
Pineapple, okay.
I was just gonna really quickly say, I was telling Connie the story today, how important pharmacists are, and I think some people negate that. So about 5 years ago, my husband wasn't feeling well, and he went to the doctor, and doctor he goes to all the time, has a good relationship with, gave him a prescription for something. It was something he had taken years ago. Long story short, he had a drug interaction that nearly killed him. However, he had a great relationship with the pharmacist. Every time he would go in, he would talk to Susan. They would laugh, they would giggle. She got to know him really well. And he had come in, he'd gone back to the doctor twice after he had been given this medicine. And the doctor just kept saying, keep taking it, you'll feel better, just keep doing it. And when he went to the pharmacist, he had an interaction with Susan. Susan was in the back and she saw him, and he had left, and she called me personally on the phone and said, Casey, I just saw Daniel, something's not right. Have him come back up. I went and got him, brought him back up. Excuse me. What he had could have killed him within a week. He was so sick by the time we got it all out of the system. So I say all that to say, if you don't know your pharmacist, spend some time to get to know your pharmacist. I totally believe that the doctor could have killed him and the pharmacist saved his life. So thank you for what you do.
Any doctor
Seriously. No jokes. Thank you.
Just pay attention. What you take home from this is just you are your own advocate, okay? You go home and look at your meds and play with it. You say, hey, do I need this? Is that safe? Is that effective? Do I need this anymore?
I will tell you this too, we fired the doctor. So I think that's another thing, is like if you're going to a doctor and they're not listening to you, he kept saying like, I don't feel well. I'm not feeling well, and it was getting worse. And then the doctor kept saying, just keep taking it. And so anyway, pay attention to the doctor and get to know your pharmacist. They're fabulous.
It depends. It depends. I trust your gut. Trust your gut. It will tell you your intuition. It will tell you. Yes.
This new website was the Front RX. What do you know about all that? What's your 10 cents on that?
I
Is it
did
gonna
not.
work? Is
I
it
did
not
not
gonna
follow
work? Is it
social
cheap?
media
Whatever.
anymore.
What?
I'm sorry. I did not follow social media anymore.
She doesn't follow social media.
But I heard you say a
Deal.
discount program.
Really?
Yeah. I just. Yeah, I'm sorry.
I don't know about it either, but my first inclination is I think you type in your prescription drug that you're already taking.
It's just similar
And
to
it
good
gives you a
Rx.
better price.
Yeah, just similar
It's
to good Rx.
not giving you, it's not prescribing the drugs.
No,
Yeah.
I mean, the
Just
cost.
some your discount.
When you gonna get the, when are you gonna get the discount? We're after dollars, right? So when you gonna get the discount? When's our insurance company gonna take that and work with it and
You
what
have to,
schedule
okay,
time?
here's the thing. To me, I think it's just like good Rx. Have you heard of good Rx discount program for patients who don't have insurance? That can help to give some discount on certain medicine, not all medicine. Walmart, I look at Walmart. Walmart does not accept good Rx on a lot of medicine now because we're losing money. We don't get reimbursement from those programs, so we stop taking good Rx for certain medicine. So I would think that if it's not insurance, we don't get paid for it, okay? So if you have insurance, use it. If you have that program that's cheaper for you, use it. Whatever best for you, and if it works with that pharmacy, some pharmacy will not accept it because we don't make money and we cannot maintain business with programs that don't reimburse pharmacists. So you have to think that way, yes.
I was just gonna comment on the the Trump program. I checked that about a week ago and plugged in the drug that, we were checking on, and it gave you a discount price and whatnot. But I read the fine print, and what I found out is that, well, that doesn't always work for people on Medicare or any kind of
Right,
government
you cannot use
insurance.
same
So if you've
thing.
got Medicare.
You have to read fine print.
It may not work.
Yes. Right, it might or might not, and the pharmacy, depends on the pharmacy too.
I was just gonna say, we have insurance, but sometimes Good RX is that insurance price.
Yes, I agree.
So we have them checked up.
Correct, that's what you should do to save, that's fine.
Just have to comment on one more thing, that all of us that are at this young age in this generation were raised during a time and were told by our parents and others that the doctor knows best.
Right.
That the doctor is someone that is the final word. And so we came up through the years thinking that the doctor had the answers. And this is somewhat of a disadvantage because some of my friends that are as young as I am, they say, well, whatever the doctor says.
Right.
And I said, well, don't you talk to the doctor and ask questions? And they said, well, no, we should be asking them questions. They know anyway.
Yeah.
So
Yeah.
I'm thinking that hopefully the younger generations are paying attention and becoming their own advocates.
Yeah,
Because
I agree.
that's what.
That's why we have classes like this, right?
Exactly.
Yeah, because you
Thank
need to be your own advocate, to save your own life. Because at the end of the day, who cares, right? Who cares? So, I grew up in an Asian family, doctor's still number one. But we teach our kids to questions, and then learn so that we can help ourselves. So, yeah.
I just have a comment, just to back you up, that our bodies do have the ability to heal itself. And as a nurse of 33 years, those doctors are learning how, when your patient comes into your exam room and presents with this, and this is how you are to write that prescription. You are to be your own advocate, and I totally agree with you that sometimes a pill is not the solution. Your body's gonna recognize food and the nutrients that come from the food, not from a synthetic pill. You're gonna be peeing and pooping that stuff out. And it all has to be based on cellular level and how your gut is at the cellular level. That's all.
We're gonna go ahead, if you have questions, we're gonna break up and let you mingle and go through there real quick. I wanna be respectful of your time. Thank you so much, Dr. Wonderful. Absolutely, this is just wonderful. Don't forget, Time for Living to be 100 in Mustang next month. And we will see you then. Thank you for coming.